This award, which is a Rising Star Award given by the International Workshop on Lung Health, and this year is going to be held in Lisbon, Portugal. So this award is based on our work on a causal association between adult onset asthma and brain matter change. So there are two different types of asthma in terms of the development of asthma. One is called childhood onset asthma, which happens mostly in children. And there is another form of asthma which is called adult onset asthma that happens in adults. So what we found is that the adult onset asthma is associated with brain white matter reduction. So we figured out a causal association. So what happens in cross-sectional studies, we are unable to figure out any sort of causal association because of the nature of the design. And to figure out a causal association, either we need to do a randomized controlled trial or we have to have a longitudinal study over a long period of time. But there is a possibility that using genome-wide association study databases, we can figure out that certain genetic components are associated with both the exposures and the outcome. Here, the exposure is adult onset asthma and the outcome is reduction in white matter. So we figured out that certain SNPs or the single nucleotide polymorphisms are actually responsible for both the adult onset asthma as well as reduction in brain white matter. So through this study, we were able to disentangle a very direct and causal link that adult onset asthma is a risk factor for brain white matter reduction. And the white matter reduction is mostly associated with motor neuron disorders. So sometimes in case of Parkinson's diseases, what we actually see patients with a trembling or shaking hands or shaking limbs. But we didn't know that whether there is a causal association between chronic respiratory disease and this type of neurological manifestations, which are actually contributed by the changes in brain white matter. So we figured out that there is a causal association that exists between chronic respiratory diseases such as asthma and white matter reduction, which may lead to some other neurological manifestations such as Parkinson's diseases. The International Workshop on Lung Health, it started several years ago, and they bring together some of the best people, some of the best researchers of respiratory medicine for a very comprehensive 3 days workshop. And this year I was one of the two recipients of the Rising Star Award. Every year they usually give to 2 to 3 people, and most of them are actually clinicians. So I've been very fortunate that being a basic scientist, I was able to bag that honor. For an early career faculty, this type of award gives a lot of motivation. And there are not many people who are actually working on respiratory epidemiology in India. So this type of award gives some sort of boost to people, to faculty members, to early career researchers, that there are prospects of doing respiratory epidemiology.